a lot of student nurses in their first 6 months fail their PTS exams because they don't know the area of concentration and they don't know past PTS questions, all right, in School of Nursing. So in this video I'll be telling you the PTS past questions in anatomy, sociology and other courses, but for this video I'll only talk on anatomy, past PTS questions anatomy. The next video I will also do the same on sociology. Okay, so I will start from the time I wrote my PTS exam back then in 2014, then from to latest 2022. Okay, I have collected data from different students that have written these PTS exams in all these years, and they share with me the common question they encounter and those ones that were difficult for them to answer. Okay, so I'm going to compile all those questions and share with you in this video. I'll go as much as explaining some of them, those one I can remember, and those one that I can't remember. I'll just list the question for you so that you can go and research on your own. Okay, I will start with anatomy. The first chapter of anatomy, you know that in School of Nursing here in Nigeria we are using Rose and Wilson. Okay, that's the anatomy and physiology textbook that is recommended in School of Nursing, Rose and Wilson. So if you look at the first chapter of the Rose and Wilson, it's talking about the body organization, that is the cell, the tissue, the organs, and a lot of electrolyte and stuff like that. Okay, so some students focus so much on cell in the first chapter instead of reading about the anatomical terms like the body part, the regional terms or the directional terms, okay, related to anatomy, like posterior, anterior, dorsal, ventral, all those positions that will help you to describe any organs. Okay, in the first unit, in the first chapter of anatomy, what they often ask there is describe with a well-labeled diagram, describe the region of abdominal cavity. Describe the region of abdominal cavity. Now, abdominal cavity has 9 regions. We have the epigastric, which is here. We have the hypogastric. We have the umbilical. We have the lumbar. We have the left and right lumbar. We have left and right iliac fossa. Okay, so you need to understand this. They asked this question in 2014, 2015, 2016, even in 2017. Okay, so it's one of those questions that is often repeated, so you need to know the region of the abdominal cavity very well. Another question in that chapter 1 is the anatomical terms, the directional terms. That is, you should know where that is the posterior, the superior, the anterior, okay, the lateral, medial, all those terms. Okay, so you should master them. Sagittal, occipital, you should know all those terms in the first chapter of Rose and Wilson. It's very important. It's what they often said almost every year. Okay, another thing is tissue. Okay, types of tissue. You have epithelial tissue, connective tissue, and the rest of them. Just know them in case you are asked to list 5 types of tissue. Of course, you should know that blood is also a tissue. It's a fluid tissue. So know all these things, know those basic things. Don't focus so much on cell. The next system is cardiovascular system. Okay, in cardiovascular system, the most often asked questions are the conductive system of the heart, the blood circulation. Okay, you should know how blood is being circulated in the body, and the conductive system of the heart has to do with the electrical activities of the heart, how the heart charge and contract and relax. Okay, so that's it. You need to know that. You need to know how the blood is being circulated in the body, which is very, very essential. Okay, then aside from that, you should know how to describe the heart. Know the heart muscles. You have the smooth muscle, the skeletal muscle, and the cardiac muscle. Okay, so you know those few things. If you can study these things that I just mentioned, I'm sure that nothing will stop you from answering questions in cardiovascular system. In 2016, PTS students were asked to describe a lymph node with a well-labeled diagram. Describe a lymph node. A lymph node is an organ that helps the body to fight infection. Okay, it is under lymphatic system. A lymph node is in lymphatic system. Okay, it's one of those organs that help the body to fight infection. Okay, so it plays a role of this kind of immunity. Okay, that that help the body to fight infection. So you should study the lymph node. Another organ is the spleen. Take note of the spleen and the lymph node. In 2017, PTS students were asked to state the general characteristic of synovial joints. Okay, and another secret is that if you know the general characteristic of a synovial joint, you can describe any joint that is under synovial joint. Of course, if you know the general characteristic, you can talk about long bone, short bone. You can describe almost all the joints in the body. Okay, so it's very good that you know how to describe bones, know how to describe long bone, and know the basic characteristic of the synovial joint. That is it for musculoskeletal system. Another thing in musculoskeletal system that they often ask, that was in 2018, they asked students to explain the neuromuscular junction. This question is a kind of confusing because a lot of students don't really get proper understanding about this neuromuscular junction. Neuro means the nervous system, and muscular means the skeletal system. So neuromuscular junction is that a point where the skeletal muscle meet the nerves. Okay, so the end part of the nerve meet together with the muscles, and the action potentials and some chemicals from the nerves and being released into the muscles, and there is some charges happening at that particular junction. So you need to get full details about neuromuscular junction and study in advance, so that whenever you see this question, you know what to write. You might not know everything, but just write something, what you know. Pen it down, because it's very important, because you might not know everything, but whatever you know about that particular question, make sure you write it. Don't leave any question untouched. Another system that I would like to talk about that they often ask questions is the gastrointestinal tract or the digestive system. Okay, the GIT system or the digestive system. They asked in 2017 that PTS students should describe with a well-labeled diagram to describe the stomach, and also state the three phases. Also explain the three phases of gastric juice secretion. Oh, that's a tough one day. I remember there are three phases of gastric juice secretion. We have the cephalic phase, we have the gastric phase, and we have the intestinal phase. Okay, as the name implies, the cephalic phase is when you begin to salivate or secrete. The cephalic phase is when you begin to salivate. Okay, immediately you perceive the aroma of a food, and without even eating the food, you have begun to salivate, and acid in the stomach has begun to secrete in small quantity. Okay, so that is the cephalic phase, and before you even eat the food, a lot of things have begun to happen in the stomach. Okay, so that is it for the cephalic phase. I don't have time to talk about others, but you need to read that up. Okay, another thing you need to know in this digestive system, we need to study is the flow of bile. Know the flow of bile. Study the liver. Explain the function. No, study the liver, the diagram of the liver, and the general function of the liver. Okay, the flow of bile is also very important. The general function of the general function of the small intestine. Okay, so basically that is all what you need to focus on the GIT. Okay, then for the respiratory system, which is one of the most vital systems in the body, you have to concentrate on the lungs. You know, we have two lungs, the right lungs and the left lungs. Okay, and also know the cycle of respiration. You should know how to describe inspiration, expiration, and pause. Okay, so take note of those key words. All right, know how to draw the lungs, know the position of the heart, know how to draw the lungs, know how to describe it with the organs associated. Okay, so another thing you need to know, another important details, another important organ in this respiratory system that they often ask is the pharynx. Okay, of course you know that in respiratory system we have organs of the upper respiratory tract, then we have the organs of the lower respiratory tract. Then for the upper respiratory tract, there is one organ called the pharynx. Okay, they often ask this question. I remember when I was writing my own in 2014, they asked us to explain the pharynx. Okay, and of course you know you have to talk about the oropharynx, nasopharynx, and laryngopharynx. Okay, so you need to read that up, check out all the information necessary for you to, you know, able to read, so for you to be able to understand that properly. I believe with this one, if you can study it very well and master it, I believe you're able to answer questions, because definitely question will come out from these areas, and all this one that I'm just telling you now might be the likely question that you see. So it's better now you sit up and read on those questions. So I don't want to prolong this video. I'm going to stop here. If you haven't subscribed to this channel, kindly hit the subscribe button, turn on the notification bell so that you get notified whenever we post a video like this. All right, so see you guys in the next video.